This is ePatient Dave, and I'm with Bob Fredericks from Endocrine Associates.
Right.
How would you describe yourself and what you do?
Well, I'm an endocrinologist involved in trying to understand how to organize data and information in a way that allows us to appropriately personalize healthcare by understanding the nature of metabolism as the organizer of health.
Wow, okay. Well, we were just in a session led by Ronnie Zeiger, formed long ago of Google and now the CEO of smartpatients.com. And it was a session on the role of peer-to-peer support for patients. And there was a discussion, there was a lot of back and forth between clinicians and people in the audience, including some clinician patients, on whether any of this stuff is valid because, physicians are well trained. And Bob brought up an extraordinary story about mastocytosis, something that happened, a patient community that formed, was it 10 years ago?
At least 10 years ago, maybe more. Where I had a patient that was diagnosed with mastocytosis and realized there was not a lot of information available to patients about that. So she actually formed a grassroots organization that became national with a group of patients that had all been communicating with each other about their mastocytosis. Eventually, they wanted to have a national conference. So they invited known experts in the field to the conference, and there were about 200-300 people that showed up. And I was on the panel to make a presentation and observed a phenomenon that I thought was very unique to an organization that had started from the patients, as opposed to most of the organizations I'd attended, where they were really organized by the academic world. And there was a presentation of what was developing in mastocytosis that would be therapies for the future. And the speaker was particularly prepared to answer questions regarding that study and those findings. But that wasn't what happened. It turned out that these patients, from having talked to each other extensively prior to this meeting, had identified a number of problems that they had, the questions that they held, and the speaker, with an international expert, was unable to answer any of them because he had never considered them. These were not questions they felt that they would be able to answer, and therefore they had not been on the table. But it was the patients that had those very questions, and I thought that was an interesting phenomenon that had to do with the origin of the organization, having been patient-focused.
And this is fascinating because in my case, the questions that my patient peers helped me with were ones that don't exist in the literature, which doesn't invalidate the literature, but it just shows that if we want to do patient-centered care, we need to find out what's on the patient's mind.
Yes.
And can you give me one or two examples of questions that the patients had on dealing with life that were not in the expert's domain?
Yeah, the questions that the academic world wants to ask are limited to the ones that we feel we can answer. But the patients wanted to know why their symptoms would be aggravated by hot showers. They wanted to know why they would sometimes be preceded by chills. They wanted to know why they didn't always occur at the same time when something else was an exposure. And they all had to do with their personal subjective experience, not objective experience.
Well, and I think I'm kind of going out on a limb here, but in the era of where providers are where compensation is sometimes tied to patient experience, that a provider who can help patients with those practical issues, I would think would inevitably be preferred.
At least to listen to the questions, at least to be prepared to say, well, we may not understand that, but that is a good question that we should try to understand, and then you can do the investigation at the level of the individual case and try to find out what works for that person.
And I'm just imagining on the fly, but wouldn't it be great if we collectively figured out a way to go find answers to practical questions like that, even if they're not in peer-reviewed literature? I don't know.
I think we should be trying to answer the questions that the patients have. Yes.
Yeah. Okay, great.
They're the ones that experience the problem.
So thanks. My point here in capturing this story was to share, especially with other clinicians as well as patients, that there is this additional world of concerns and perhaps answers in the patient community that add to the clinical issues. So thanks again.
Okay, thank you.
Bye-bye.